On June 12th, the U.S. Department of Health and Human Services sent a letter to state governors asking that they help keep eligible individuals connected to Medicaid coverage during this period of unwinding. States are now re-evaluating Medicaid eligibility after a 3-year pause in this process because of the COVID pandemic. Some states are moving quite quickly through their re-evaluations, while others, like Wisconsin, are taking their time. Early data from those states that are moving quickly suggest too many Americans are losing Medicaid coverage. It's about 1 million individuals that have been terminated from Medicaid already. The median disenrollment rate is about 40%, but there is variability in the data coming in thus far. In its letter to states, the U.S. Department of Health and Human Services says too many people are losing Medicaid and too many are losing Medicaid for procedural reasons and red tape, even if those people might still be eligible. Procedural disenrollments, losing Medicaid because of red tape, is too high. The U.S. Department of Health and Human Services Secretary Becerra said, "I am deeply concerned with the number of people unnecessarily losing coverage, especially those who appear to have lost coverage for avoidable reasons that state Medicaid offices have the power to prevent or to mitigate." They're especially concerned about the number of children losing coverage. For example, in the state of Indiana, about 1/3 of the people losing coverage are kids, while in the state of Arkansas, it's closer to half. Secretary Becerra offers some options for states. He says, first of all, slow down. You can take the full 12 months to do your re-evaluations. He also says you can renew individuals who are eligible for other assistance programs. You can update people's contact information. You can do better at finding them, and you can get some help. Get some help from schools, community organizations, churches that might be able to help spread the word and help people actually put in their renewals and redeterminations. Now remember, this whole process is because of the COVID pandemic. People were held in continuous Medicaid eligibility during the pandemic. That has now changed, and states are able to start the process of reviewing eligibility and redetermining who can keep Medicaid and who should be terminated. Wisconsin, like we said, is one of those states that is taking its time. In the month of June, only people that have gotten notice that a June renewal is due should be taking action steps. Everybody else will keep their coverage until their renewal month comes, at what time they'll submit their own renewal paperwork. We give you data from the states that have reported terminations thus far and other action steps for families in the description below.